Hip dysplasia is when the normal ball and socket shape of the hip joint doesn't form properly. Most commonly, it's associated with certain risk factors in infancy. And those sorts of things might be a firstborn baby because they're packaged more tightly, female babies more than males, breech delivery or being upside down in the womb, certain ethnicities and syndromes, and most importantly, having a family history of other first-degree relatives who have had hip dysplasia. Most cases can be picked up by routine screenings, just at the pediatrician's office, examining the hips. And if it's picked up early, it can be treated very simply with a brace that may only have to be worn for a couple of months and no need for surgery. The later detected cases after walking age are usually someone whose hip is going out of joint. And those require major open surgery and bony realignment. So later diagnosed cases are certainly more complex, but in no way are they a lost cause. There certainly are good treatments available, but they really should be done at specialized centers. It is sometimes a misperception that if you're diagnosed late, it should just be let go and you should have a hip replacement. We would argue that because hip replacements done at young ages really don't function well. And in a child, even a little bit older of a child, you still have a real chance to put the hip joint back where it belongs, and it can grow properly and do very well. In treating hip dysplasia, you really need a whole team of people, actually not just the doctors, but also very much our nurses, therapists, cast techs, folks in the operating room. So it's really very complex in deciding what is best for each child and what the long-term outcomes are going to be. And we can offer that spectrum here really from infancy all the way to young adulthood. My favorite part is just taking care of kids and seeing them get better and being a part of that. The amazing thing to me is that the operations work better in children because of their tremendous biology, the fact that they're still growing, and if you just guide something in the right direction, it can grow properly. But the main thing for me is seeing that you can make a difference in a child's life and you can help them be better off in the long run.